important complication in patients with sickle cell anemia is the osteonecrosis, right? So this painful and sometimes crippling complications, they most often affect the hips, right? Where do you see this commonly? In the hips, right? And that too bilateral, right? Most often it affects the hips and that too bilateral. And this occurs in about half of all the patients with sickle cell anemia, right? So in almost 50% of patients with sickle cell anemia, you have the involvement of this particular hip. And it is also common in patients with HbSC disease. And what is this HbSC? The individual having one hemoglobin of sickle type and the other one is hemoglobin C. Okay. And apart from this particular hips, shoulders. Right? The shoulders, they are less often affected. Right? The shoulders, they are less often affected, right? And beginning with the chronic pain, that can become severe. So initially the pain will be gradual, right? So the pain will be a gradual pain. Later, this particular pain, it will become very severe, causing the loss of function. Right, causing the loss of function, right? And the loss of function, it is the final stage. Right, loss of function, this will be the final stage, especially in the hips, right? And how can you detect this osteonecrosis? That is the MRI. MRI can detect this osteonecrosis in the early stages. Whereas, is there any role of the X-ray? The X-ray, they are found to be less sensitive. Right? X-rays, they are found to be less sensitive. And what is the treatment that you can give? So, the treatment is for the osteonecrosis, you need to give physical therapy and as well as the NSAIDs. So physical therapy and NSAIDs, they provide some relief, right? And unfortunately, oral opioids are sometimes required. Okay? So opioids are required, but sometimes required. Where otherwise, the NSAIDs, they provide some relief and physical therapy is also very important. And next is the joint replacement. The joint replacement can restore the lost mobility. So those individuals where they're like, the function is like severely affected, then, right? So in them, the joint replacement. Joint replacement can restore the lost mobility and the joint replacement can also relieve the pain. Right? So it can relieve the pain and it can restore the lost mobility. But the lifespan of the prosthetic joints is finite. So surgery should be delayed as long as mobility is satisfactory. Okay, because the prosthetic joints, whatever we place, right, the prosthetic joints, whatever we place, the lifespan of this particular prosthetic joint is like a certain period of time. That is the reason why the surgery should be delayed as long as the mobility is satisfactory, as long as the pain is tolerable. So that is about the joint replacement. So this is about the osteonecrosis.